everyone. Welcome to this session on comprehensive ophthalmology. We have our first presenter whose paper is on comparison of lid reconstruction surgery with and without using 10/14F catheter as tissue expander. So please go ahead.
Good afternoon to all. Sorry.
Yeah, you're the presenting author.
Yeah,
Dr.
presenting
Anvesha
author.
Maitra.
Yeah. Dr. Kalpana Suresh. Yeah.
Go ahead.
Respected chairpersons and delegates, good afternoon to all. And my topic is on safety and efficacy of topical.
Just a moment.
Dr.
Yes.
Kalpana.
Sorry.
You are Anvesha.
I am Dr. Kalpana Suresh.
No, the first.
No, then the first.
The first paper is by Dr. Anvesha.
Anvesha Maitra. Why haven't you come, Anvesha?
Okay.
So,
my
1 second. She'll be talking on safety and efficacy of topical chloroquine as an adjunct to CMC 1% in mild, moderate dry eye disease. Go ahead, Kalpana.
Yeah. So my topic is on safety and efficacy of topical chloroquine along with CMC in mild to moderate dry eye disease. I have no financial interest to disclose. So as you all know, dry eye disease is a chronic pain syndrome affecting the quality of life adversely in patients. It's characterized by instability of a tear film with or without inflammation of the ocular surface and lacrimal glands, and accompanied by increased osmolality of the tear film and inflammation of the ocular surface. So various studies have revealed that inflammatory component to be the main causative factor in this disorder. Cytokine and receptor mediated inflammatory cascade and apoptosis have also been implicated in the pathogenesis of dry eye. Current therapies include tear supplementation, retention stimulation, along with anti-inflammatory agents. And chloroquine, as you all know, is a well-known anti-inflammatory drug used in the treatment of connective tissue disorders. And it has been evaluated on dry eye disease associated with inflammatory syndromes like Sjogren's, primary Sjogren's, and they concluded that there's a significant relief of symptoms of dry eye disease. And our aim is to evaluate the role of topical hydroxychloroquine, chloroquine as an adjunct to CMC 0.5% in the management of mild to moderate dry eye disease. It's a prospective pilot comparative study. Study population is 100. Both genders are included. Age is from 30 to 70 years and study duration is for 3 months. So 100 patients with symptoms of mild to moderate dry eye were included in this study. They were divided into 2 groups of 50 each. Group 1 received topical CMC 0.5% 3 times a day for 3 months. And group 2 in addition received chloroquine 0.03% twice a day for 3 months. The outcome measures were ocular surface disease index, breakup time, Schemmer's test, ocular surface staining. And they were followed up at the end of 1 month and 3 months. And the exclusion criteria include patients with systemic or local ocular diseases known to have caused dry eye, history of chronic contact lens wear, ocular surgeries in the past, and patients on local or systemic medications which is known to cause dry eye. And this was a dry eye disease questionnaire that was given to the patient. And the answers were recorded as how frequently these symptoms occur, if it is rare or sometimes or often or all the time. The presence of one or more symptoms often or all the time were taken as positive. An examination included visual acuity, condition of lids, meibomian glands, conjunctival surface and corneal surface, and post-segment evaluation. And dry eye disease test included breakup time, marginal tear strip evaluation, Schemmer's 1, staining with fluorescent and LG stain. Van Bisterval scoring system was used to assess the staining of ocular surface. And even asymptomatic patients with positive clinical signs were also considered to have dry eye. The follow-up was done at 1 and 3 months. And grading was done with Deuce dry eye severity grading system into mild, moderate, severe or very severe. Only mild to moderate cases were included in the study. And according to the symptoms, signs and the scoring system. Statistical analysis was used for chi-square and quantitative student t-test. And degree of improvement of parameters were assessed during repeated ANOVA. And between the 2 groups, it was compared using 2-way ANOVA. So coming to the treatment results, this is a trend line of improvement in different parameters in group 1 and group 2. That is the breakup time, Schemmer's, and lissamine green staining. So mean breakup time recorded in group 1 was better than in group 2 in all the follow-up visits. And degree of improvement of breakup time was 12 weeks after treatment from retreatment in 2 groups. But the rate of improvement in 2 groups were also similar. So implying that both the drugs were restoring breakup time to normal as equal in equal duration of time. Next, the marginal tear strip. Group 1 shows significant improvement, but it takes 8 to 12 weeks to improve. Whereas group 2 showed significant improvement in marginal tear strip in first 8 weeks, followed by a plateau, thus showing early onset of action and fast attainment of maximum respite. So this is the improvement in marginal tear strip. You can see with the pre-treatment, and this is group 1. It shows only at 8 weeks, but whereas in group 2, it shows early improvement. Also, the changes in Schimmer's value from the pre-treatment was found to be statistically significant, and the rate of improvement was much better, both in Schimmer's and fluorescent staining in group 2. Yeah. So conclusion is, both chloroquine and CMC are equally effective in treating dry eye, but the faster onset of action was observed with chloroquine group. And lissamine green was the only test showing chloroquine to be better than CMC. So differentiation can be due to different mechanism of action of CMC and chloroquine. Chloroquine is postulated to have anti-inflammatory and anti-apoptotic effect. So this might be the reason behind early improvement of ocular staining scores in chloroquine group. However, further studies at larger scale need to be done to corroborate, as this is a pilot study. These are my references, and thank you.
I want to know what is new about your study, because chloroquine has been in use for long. CMC has also been in use for long for treatment of dry eye. So what is the novelty of your paper?
So initially you can start with chloroquine.
Right away.
That is for a faster relief and improvement of all the parameters, and then it can be sustained with carboxymethyl cellulose, because finally the end result both attain the same quality of improvement.
But
because this reaches at 4 to 6 weeks, all the parameters seem to improve with chloroquine. It's faster than CMC. So you can start the treatment with chloroquine if you consider it as an inflammatory process, and sustain with CMC.
Because I think till now the reverse has been the...
But yeah, exactly, because your title of the talk is the chloroquine as an adjunct.
Yeah.
Adjunct.
So that means...
but we in group
CMC.
1 we use only CMC, but in group 2 with CMC, chloroquine was also added.
But then your title itself is misleading.
You add chloroquine to CMC, not CMC to chloroquine.
No,
chloroquine to CMC.
Yes, but...
Yes, but you are talking the reverse, just reverse. You are talking that you start
No,
with
this is a proposal. I have not done the study with chloroquine alone.
No, we understand that.
So I propose that chloroquine can be started initially to...
your topic should have been different, Kalpana.
No. My study was as an adjunct.
But
chloroquine as an adjunct.
What was different?
So because it was recovery was a little faster in chloroquine group, we propose another study has to be done, but that's not the conclusion of this study. This study shows a better improvement in chloroquine along with CMC group. So we can further...
As an adjunct,
As an adjunct.
Not starting chloroquine first.
No.
And then adding CMC.
No, that's not the study. So in future we can do a study to find out.
You are just now telling that you start with chloroquine and then...
Yeah, the study is not about...
Thank you very much.
Anyway, okay, fine. Thank you. The next one, please.
Excuse me.
Yes.
Which brand UV lube? What you have used? Chloroquine? What form you have used?
Chloroquine UV lube by drops.
UV lube, only one.
Only one.
Okay.
As far as I know, only one brand is available so far.
There are many brands available.
Hello.
0.03% UV lube.
It's okay.
Was it in Unim's form or
No, it's a
eye drops?
regular eye drops form. Regular eye drops, not unims.